Good afternoon, and thanks for joining us for today's webinar. A couple housekeeping notes before we begin. In this platform, all attendees are muted. While you can't ask questions through audio, please note the Q&A function on your screen. If you have a question that is not addressed in the presentation, please submit through the Q&A feature, and our presenters will try to answer as many as possible at the end. Also, today's session is being recorded. As a registrant of today's webinar, you will receive an email with a link to view the recording once it's available. It's now my pleasure to introduce our speakers for today. Dr. Samina Ahmed is an adult cognitive behavioral medicine specialist with University Hospitals. Dr. Eric Yeh is an adult sleep specialist with University Hospitals. And Dr. Nardine Zachary is also an adult sleep specialist with University Hospitals. And she's going to kick off our presentation. So I'll just go to the next slide, and Dr. Zachary, you can take it from there. You may need to take yourself off mute, Dr. Zachary.
Hi, good afternoon. This is Dr. Zachary. We'll start out by talking about some of the sleep structures that we experience when we're sleeping. Then we'll move on to the importance of sleep, sleep deprivation, sleep disorders, and specifically obstructive sleep apnea. These are the main sleep stages. We have two main categories. The first one is highlighted here in green, which is REM sleep. This is rapid eye movement sleep. And then we have the blue ones, which are the non-REM sleep. And these are divided into stage 1, 2, and 3. As we progress through these, we get deeper in sleep. So once we start falling asleep, we go into stage 1. Then stage 2 is a little bit deeper, and stage 3 is deep sleep. Then we move on to rapid eye movement sleep, which is when we do experience dreaming. So why do we need to sleep? Sleep is very important in terms of memory consolidation. It also helps with better function during the day. It helps us with our immune system health. It reduces the risk for injuries and accidents, and for hormone regulation, and to stay healthy, and for restorative reasons. Sleep deprivation is very common, unfortunately, in the United States. Most adults need 7+ hours of sleep per day. However, 35% of Americans report getting less than that recommended time. What are some of the effects of sleep deprivation? Things that have been associated with sleep deprivation include psychomotor impairment, decreased productivity and performance, changes in mood and behavior, including depression and psych problems, motor vehicle accidents. It's been shown that about 16 hours of continued wakefulness is similar to a blood alcohol concentration of 0.05%. And the 28-hour continued wakefulness is similar to a blood concentration of alcohol of 0.1%. Also, sleep deprivation has been associated with weight gain, diabetes, high blood pressure, heart disease, stroke, and biologic aging. Here are some sleep disorders that patient might experience. Insomnia is when you can't sleep. So that includes not being able to fall asleep quickly enough, or waking up multiple times at night and not being able to sleep through the night. It also can include waking up too early. Breathing disturbances include having symptoms of snoring, apneas, loud breathing, gasping, morning headaches, and this category includes sleep apnea. Hypersomnias include feeling too sleepy during the day. Parasomnias include sleepwalking, sleep talking, acting out of dreams. Movement disorders include restlessness, kicking in sleep, jerking, and unrestful sleep. Circadian rhythm disorders can include not being able to sleep at the right times, and it's considered the biological clock dysfunction, meaning sometimes our own biological clock is not set to the same level as the regular clock. So a patient might want to sleep during the night and wake up during the day to pursue their daily activities. However, they might be unable to sleep at the desired time and then fall asleep too late, which can cause problems in terms of waking up maybe too late and missing work or missing school. So it's just an irregularity in that biological clock. We're going to focus on obstructive sleep apnea. And obstructive sleep apnea is a collapse in the airway which prevents air from getting into your lungs. You can see in the pictures, a normal airway, you can take a breath in through your nose and it goes right through the back of your throat and goes to your lungs without any issues. If you have a narrowed airway, you have a little bit of obstruction that can hinder the passage of the air through that area, and it can cause breathing issues. And then all the way to the closed airway, you can see that the air goes in through the nose. However, it's not able to cross at all through to the lungs. And what that causes is problems with sleeping and getting oxygen that you need while you're sleeping because you're not getting enough air through to your system. Your body's initial response would be to try to wake up to take a deep breath. And that can cause issues in terms of sleeping through the night. So patients might experience waking up multiple times because of these respiratory events to be able to breathe better. However, sometimes we're not able to remember that we are waking up. So sometimes we're waking up such a short period of time that we don't even notice it. But then when we wake up in the morning, we might find ourselves feeling unrefreshed or feeling that we did not sleep much. And that's because of these respiratory disturbances that happen through the night. This puts a lot of stress on the system, especially that oxygen level fluctuates during that period because the body's not able to get the oxygen that it needs. So these are some of the health problems that can be related to sleep apnea. And we've noticed these associations mostly in moderate to severe sleep apnea. And these include high blood pressure, coronary artery disease, congestive heart failure, type 2 diabetes, erectile dysfunction, depression, stroke, irregular heartbeat, heart attacks, heartburn, blood clots in the leg, blood clots in the lungs, high blood pressure in the lungs, attention deficit hyperactivity disorder, jaw pain, clenching or grinding of the teeth. So who has increased risk for sleep apnea? People who have a body mass index of more than or equal to 25 are at increased risk. Having a large neck, for men, that is above 17 inches. For women, it is above 16 inches. And having a narrow airway. One way you can have a narrow airway is if you have large tongue or tonsils. And that's portrayed here in the pictures where you can see the enlarged tonsils are blocking the back of the throat, which can cause a narrowed airway. Another risk factor is a recessed jaw, and that's when the lower jaw is moved a little more backward than usual, and that is highlighted here in black. Having a low muscle tone is another risk factor, and genetic predisposition, such as family history of sleep apnea. Below are some of the warning signs for sleep apnea. These include symptoms that you might be experiencing, such as loud and frequent snoring, pauses in breathing, choking and gasping, daytime sleepiness or fatigue, insomnia, and that's what we talked about earlier in terms of the multiple awakenings at night because of the need to breathe, non-refreshing sleep, morning headaches, memory and concentration problems, irritability. So how can you be tested for sleep apnea? We have two main ways to test patients for sleep apnea. These are the at-home sleep study, which is done at the convenience of your own home. You would receive equipment that you would hook up yourself at home, and you would turn on overnight while you're sleeping and turn it off in the morning when you wake up, then send the equipment back. This test is a good option for patients who would like to stay at home while getting tested. However, it measures less things than the in-lab test. So it does not monitor as many things. Thus, it does have some limitations as to what it can detect in terms of respiratory events. And it might not be a good option for everyone. So you would need to talk to your doctor and see if that's a good option for you. Sometimes it does not detect everyone who has sleep apnea. So sometimes the next step would be to get an in-lab sleep study if we're still highly suspicious of sleep apnea based on the home sleep study test. An in-lab sleep test, you would come into one of our facilities and you would get hooked up to many different monitors as seen in the picture. And we would monitor you overnight to look for the respiratory events and a few other things that we monitor. And then you would leave in the morning and we would have a result for you after that. This test is a more detailed test and it measures more things than the at-home sleep study test. Here are some treatment options for obstructive sleep apnea. The first line therapy for obstructive sleep apnea is positive airway pressure. And you can see that in the picture right here. It is a device that hooks up to a tube, which hooks up to a mask that goes on the patient's face. And what it does is that it takes room air and it pushes it through the mask to open up the airway as much as possible, because as we talked about, there's a closure in the airway with obstructive sleep apnea, and we're trying to open that up. So it pushes the air through to keep the airway open. Another option is a dental device, and this is something that is done through the dentist. Not everyone is a candidate, so a dental evaluation is needed. You would need to have enough teeth to be able to get benefit from this treatment because this hooks up to your teeth, and what it does is that it pushes the lower jaw a little bit more forward to open up the back of the throat so that it opens up the airway a little more. This therapy is not necessarily recommended for everyone. It is only recommended for certain kinds of patients. So you should definitely get evaluated by your doctor. Positional therapy is recommended for everyone. And that is when you try to sleep on your side and try to avoid back sleeping. Because when you sleep on your back, the tongue rolls back and a lot of the tissues in the back of the throat also roll back and can close up the airway even more. So it's always recommended to try to stay off your back as much as possible. Of course, we have some surgical options, but these are not first-line treatment options. And we have Inspire therapy. Inspire therapy is also portrayed here in one of the pictures, the top one. And it's a device that is being implanted into your body. So it is not a first-line treatment option either. It detects when you're stopping to breathe, and it gives little stimuli to try to open up the airway. And it does that through pushing your tongue forward and out of the way so that the airway is more open. There are many criteria for Inspire therapy, and you would need to meet that criteria before being a good candidate. One of these criteria is that you must have tried PAP therapy, which is our first line therapy, before moving to Inspire therapy.
Thank you, Dr. Zachary. And now we're going to turn it over to Dr. Yeh.
Hello. I was told that I should start my video, but 1 second. Whoa, okay. There we go. All right, hi everyone. Thank you for coming out here to listen to this, and this is great. And then I'm seeing a lot of questions already asking, and a lot of interesting questions, and I'm really glad that many of you are interested about sleep, and it seems like sleep is a common problem. It's not as easy as we thought it is. You know, just go to bed, close your eyes, and you're sleeping. You know, only if it was that easy, it would be all about. We will all be out of our jobs. So one thing that I want to talk about today, I only have a couple slides, but it's a very general, big picture type of thing, which probably affects a lot of you, and quite honestly, myself as well. And I call it coronasomnia. Like, it's some sort of sleep problems that we just really didn't even know that it was a problem, because everything just kind of changed so rapidly, and we don't know when the end is. You know, although it seems like now things are getting a little bit better, but the thing is, we're still fighting against this aftermath. You know, things that started creeping in a lot of times, usually kind of going on and show up a little bit later. And then sleep is kind of like one of those things where something happened a couple months ago or whatnot, or your schedule slightly changed, and then now you're starting to reap, you know, issues or problems or complaints on your sleep. So obviously, at the end of our later part of our conversation today, Dr. Samina Ahmed will be giving a lot more tips about insomnia and stuff like that. So I won't cover too much of those. But again, coronasomnia, that's, you know, it's not a formal term. We just kind of put it together. But this increasing rate of insomnia and sleep disturbance during this time. And, you know, obviously you're stressful, you have anxiety, you have fear, you have lack of hope, and you are isolated, and you're isolated from the general public, but God kind of put you in the same environment with, you know, it is with people you love, but sometimes you kind of need each other's own space, right? You know, get out to work for a little bit and come home. And it's just very, very different because our routine has been changed. Whether we like it or not, whether we desire to have it or not, our routine inevitably got changed. Environment got changed, routine got changed, our mentality got changed, and then it affects our sleep very much. So one of the easiest thing, or one of the things that we can all work on, you know, you, me, your partner, your family, your kids, is to try to establish that routine back. Okay, we can't change the environment, not too much. We don't know when we can just go out freely, you know, even without masks and stuff. Like, those are the things that we cannot change. And I suggest, you know what, there's nothing you can do about it, so let's not worry about it just yet. But we can worry about something that you can change, and that's a big thing. Don't worry about things that you can't change, but worry about things that you can change. So bring that routine back together. And then we're going to talk about a few things that's the easiest thing to do. And then, believe it or not, many of us, myself included, have not been able to keep that routine together. So can we go to the next slide, please, Tiffany? Okay. So your children's good night sleep starts with you, okay? And I'm really talking about, guys, people who have children at home, obviously, or even grandchildren. A good bedtime routine is crucial for children of all ages. And good bedtime routine is also very important for adults. You know, what do you do before you go to bed? What do you do before before you kind of get ready to rest? Do you have a very different things to do every day, or do you have a good routine? As your kid, what time do they actually start to get wind down? When do we turn off their screen? When do we start telling them, hey guys, number one, number two, number three, number four, number five, it's time to, get things together and to start brushing your teeth, take a bath, or whatever the routine may be. But children and family function much better if there is a structure, if there's a routine. And that is something that may be hard or maybe somewhat lost during the time of pandemic. And it's really important for us to try to bring that back even little by little. Or if you have children of various different ages, they might have different routines, but you gotta have a routine for people that works with you. And I think everyone could probably try to get the schedule down that way. Maybe you need to work a late shift or whatnot. Somebody is taking care of your children, helping you. Maybe your mom, maybe the grandmom is, but make the routine, even write it out, put it on your fridge so everybody knows what time we're supposed to do what. They function much better. They sleep much better with the structured routine. And same thing for the adults, and everything else here. Poor sleep affects everything: your mood, your stress, your appetite, your behavior, like affecting the kids. And probably you guys all feel this too. How is your relationship with your spouse, and how are we dealing with this extra stress that are in the home? Sleep affects everything. And number one thing that we could do is to bring that structure back. So just real quick refresher here. For infants, newborns, they sleep all the time. And then before they turn to a toddler, 10 to 18 hours, and all that, 9 to 16 hours as a toddler. Preschool age, 8 to 14. Anywhere in between that is okay. And then that includes your naps. And one of the questions in the Q&A is that, does your 7-hour include nap? And the answer is yes. Your total sleep time is 7 to 9 hours for the adults. So it goes from 7 to 12, 7 to 11. Hopefully your kids or somewhat is somewhere in the middle there. But for anybody over age of 18, it's 7 to 9 hours, regardless if you're 102. It's still 7 to 9 hours. That's the recommended time. So that, I hope that we get this information out there. Next slide, please. So why do we not get enough sleep? So this is mainly focused on what we know about what affects our children. But some of these also affect us as well. As kids, they have acid reflux, school age, and adolescence, they have different things. But if you see this Venn diagram right down there in the middle, poor sleep hygiene, environment, or obstructive sleep apnea, that affects everybody. That affects adults as well. I'm only going to touch on these three things right in the middle, because that poor sleep hygiene thing is number one thing that really is eating away our sleep. And like I said, this will be touched a little bit more on the later part of this presentation. But again, we could not stress enough how detrimental this thing is to every one of us. And if you're just listening and not looking at the screen here, I'm holding up my cell phone. This is one of the greatest invention. We can do everything right from right from our fingertips, but they also eat away at our sleeping time, our rest, our energy, our mood slowly, 1 minute at a time. So that's really important. Environment wise, hopefully, we could have a nice and uninterrupted environment if that's possible and feasible. And with sleep apnea, which Dr. Zachary have touched about, if those are the symptoms that you exhibit and concerns you, come to us and seek help, or talk to your primary care doctor. Next slide, please. So really important that we do it together is do it together as a family, do it together as a couple, do it together. It's just easier when we try to set something that we do together, a family meal time. If it's possible, have it at the set time every day, because you would be surprised how much, if you set that meal time, it's not 6 o'clock today, 8 o'clock tomorrow, it's not 5 o'clock today, 9 o'clock the next day. If we can set it that day around whatever time it may be, 6 o'clock, 7 o'clock, it doesn't matter. but you having that family time together improves the family harmony and also sets everybody more on the same thing, because now you always finish dinner probably around the same time, and now you go off to do your thing. Maybe mom does this, dad does this, dad go do dishes, dad do this, because I'm a dad, I do a lot of that. Mom just go there and relax, fine, be that way. So go there and relax, but everybody is kind of starting off their evening schedule right on the same spot. The kids do their things, and then it's much easier to bring that routine back. And hopefully this family meal time is applicable to all of you, and we'll be able to actually have a set time together. And family activity time, the same thing. If we're able to kind of bring these things together, all these things are just examples of us bringing more structure and being more functional as a family, especially in the time of pandemic like this. You'll be surprised of how much, if you invest and put these into our daily routine and schedule, that this will help you to actually fall asleep at night better, just because you brought this structure back in. Family activity time, Saturdays and all that, it's time to, it's now back in the 40s, 50s, and 60s. It's time to go out, getting that exercise in, having that, good feeling with moving around, and all that exercise out there is going to help you with your evening rest as well. And your overall wellness is very much dependent on these things, these little things that we do. Okay, next slide, please. So I would encourage that all of you take this a moment to kind of rate these 6 questions between 0, 1, and 2. And you can write it down, and we can probably review that at the very end. Regularity. I mean, this is a thing that we try to push out, and to just evaluate everyone's sleep health. Are you sated? Meaning, are you satisfied, or whatnot? First of all, regularity. Is your bedtime and wake time occurring around the same time? So every single question is 0, 1, and 2. 2 is always, 1 is sometimes, 0 is never. So it's really easy for you to kind of jot down. Regularity. Is it regular within 1 hour every day? Are you satisfied with your sleep? Are you alert during the day? Are you awake all day without going like this? Okay, dozing off. Timing, between 2 o'clock and 4 o'clock in the morning, when everything is so dark out there, what are you doing? Are you asleep, or are you trying to sleep? If you are doing one of those, then that will be a 2. But sometimes that will be a 1. Okay. Efficiency, do you feel like you're up between the time you go to sleep, between the time you get up? Are you awake more than 30 minutes during that time? If you are, are you able to have less than 30 minutes of wake time during your sleep? Okay. And duration is 7 to 9 hours. So 0, 1, 2, 0 is never, 1 is sometimes, 2 is always, and see how much you score. The higher score you are, the better your sleep satisfaction should be. If you feel like with this questionnaire, your score is pretty low, maybe a 6, a 5, I think it's time to talk to someone, and, to your primary care, or come talk to us. We're here to help. All right, that will be it for my 12 minutes. I hope I didn't go over.
Thank you, Dr. Ye. That was great. Appreciate your time. Dr. Ahmed, did you want to share your screen, or do you want me to just keep control of the slides?
Either way is fine. We can just keep going if you'd like.
Continue. Sure.
Okay. It's not letting me share my video though. There we go. Hi, everyone. Thank you for joining us. All right, so I'm actually just going to take over from where Dr. Ye is leaving off. What you're hopefully recognizing is, sure, there are specific sleep disorders and difficult medical diagnoses that we can have that impact our health, but generally speaking, sleep is also a vital function. It's just as important to us in our wellness, just as nutrition and maintaining healthy weight. So you don't have to have diabetes to work on your weight management, right? You don't have to have significant trauma or anxiety difficulties to focus on stress management. So similarly, you don't necessarily need a sleep disorder diagnosis, and you don't need to have a clinical definition of insomnia to want to do something to improve upon your sleep habits. And hopefully my goal is to try to teach you guys some skills that you can start implementing tonight that could be beneficial in improving your sleep health. Next. All right, so generally speaking, we want to focus on 3 main components. The first being building up your sleep pressure. So the longer you go without sleeping, the sleepier you get, all right? And some of us, especially during the phases of coronavirus have fallen into this poor pattern of inactivity, right? When now we're sent at home, we're working from home, we're at our desks, there's nowhere really to go, nowhere to socialize, nowhere to engage with other people. And so this inactivity may cause you a little bit more napping because you're both bored, inactive, maybe a little bit tired. And so unfortunately, the more you're napping during the day, it starts to take away from your nighttime sleep. Because again, you need enough pressure to sleep at night. So if you use up some of that pressure during the day, you're not going to sleep that well at nighttime. Now, if you're not sleeping at nighttime, here comes the daytime fatigue and the lethargy, right? And so that is a feedback loop. And now it's just going to keep going. And so you really want to focus on maintaining good cycles of sleep. Physical activity, getting out and about. If you're stuck at home, no problem. Step outside into the sun. Take a walk around your yard. Take a walk around your neighborhood, right? Do whatever is within your means of control to introduce more activity in your day. Definitely try to avoid napping, regardless of how tired you might be, because the more the longer you go without sleeping, the better you'll sleep that night. All right, typically speaking. And then that's going to lead to more energy and less fatigue during the day, so you're able to keep up with your daily demands. Next slide. All right. So on top of building up your sleep pressure, the next thing you want to do is really strengthen your circadian rhythm. Now, our circadian rhythm, it actually regulates productions of different hormones over the 24-hour cycle. One hormone is cortisol. Cortisol helps with allowing us to feel more awake during the day, as well as melatonin. Melatonin is a hormone that allows us to feel more drowsy in the evening hours. Other physiological processes that it helps regulate include hunger and digestion, body temperatures, mood, and other factors. So then we know how we should be feeling and when we should be feeling and what needs our body needs throughout that 24-hour cycle. Now, zeitgebers are actually what we call time regulators or synchronizers. So what they do is help regulate and manage our circadian rhythm to keep it fixed. And the most important signal or timekeeper is actually light. And then we have social interaction, physical activity, food intake and timing of that food intake, and finally body temperature. So for bright light, the more sunlight you can get during the day, the better. And then of course you want to avoid any kind of bright light in the evening hours. So that's essentially what Dr. Ye was referring to with the cell phone use, is the brightness of that blue light that's in our cell phones and our smart TVs is actually very bright and mimics the brightness of the sun. And so the more exposure you have to that cell phone, which is relatively close to your face in the evening hours, the more your brain is thinking that it's time to wake up and be awake and fully functional. So it reduces your quality of sleep and your ability to fall asleep. So definitely keep the brightness and daylight hours for the day, at least 30 to 60 minutes after you first wake up. And then you want to focus on reducing that light come bedtime. So put on a blue light filter, turn down your screen or avoid it altogether, ideally, and keep the blinds down, etc. The nice thing is by maintaining good bright light exposure, you're also benefiting your mood as well as improving any sleep inertia. So that's that original morning grogginess you might be experiencing when you first get out of bed, right? Open up your curtains, open up the blinds, bring a lot of sunlight into the house, into the room, and the chances of the sleepiness will start to resolve on its own. Socializing. I won't go into in more detail, but again, plan these social activities, plan physical exercise, make room for it, make time for it. Games, puzzles, anything you can do, whether it's on your own or with a group of people, is likely to help maintain a lot of these circadian rhythms as well as your sleep schedule for you. Next slide. Okay, so how to strengthen your circadian rhythm? Have a wind down period. Just like with children, there's a bedtime routine. Oftentimes as adults, we forgo it. And it's that just as important for us as it is with children, right? You don't want to be in a position where you go all day at work, come home, grab dinner, take down whatever you can, and then jump right into bed to try to get as much sleep as possible. The chances of you falling asleep are pretty slim, all right? You want to try to give yourself a half hour to an hour before bed to focus on winding down, wrapping up the day, putting your stressors and worries to rest, and then allowing that natural sleepiness and the melatonin to kick in so you can fall asleep. So reduce that light exposure, use those blue light filters, avoid the cell phone if possible. The television is not as problematic because it's a little bit further away. It's not directly in our face. But definitely focus on relaxing activities, and then don't get into bed until you're ready to fall asleep. We don't need a bedtime. it's not necessary. And every day is going to be a little bit different. Some days we're more active and you're likely to crash as soon as you lay down. Other days are more sedentary. Maybe it's rainy. We didn't talk to a lot of people today. Those days you're going to be less tired from bedtime. So there's a good chance you might stay up a little bit later. So listen to your body and recognize what it wants. Don't go to bed until you're ready to fall asleep. And try to maintain as much consistency as possible. I know it sounds a little counterintuitive, but more or less you'll recognize that it's within the same hour or so. In terms of your sleep schedule, 7 to 8 hours, up to 9 hours is the recommended guideline. You want to anchor your schedule with an alarm time. So wake up consistently at the same time every day. That will help you determine what your bedtime is going to be, just 8 hours from your alarm. Keep this consistent even on weekends, and then focus on what's normal for you and what you can maintain and what's consistent. Some people enjoy being up to 12, 1 in the morning, and then they want to wake up at 8, 9 in the morning the next day. Perfectly fine. Just keep it consistent for yourself. And then same thing with the wake up routine, get up and exit the bed as soon as you're awake, get that sunlight in, start your breakfast so your metabolism starts going, start scheduling activities in the day, especially in the morning hours, so you're more likely to get up, right? We're really good about leaving the bed if we have an appointment or a meeting or something work related. Otherwise we'll struggle and want to stay in bed a little longer. And take care of that initial grogginess that might be occurring once you awake. Next slide. In terms of fitness and recovery, this is really our body's best opportunity to rest the heart and repair our cells and tissues, right? It allows you to recover and reduce any risk of injury, also promoting cardiovascular health and reducing your chances of getting ill, getting sick, and being able to fight off an infection. So if you're trying to deal with not getting coronavirus and keeping your best health, look into physical exercise. In terms of mental state, it helps us retain and consolidate our memories, learn new skills from memories, and improve our performance, improve and retain cognitive function, such as decision-making and adapting to new situations, as well as improving mood and reducing risk of depression and anxiety. Next slide. And so you really want to look for a combined cardio and strength training approach. This will both improve your sleep quality and reduce any daytime sleepiness, as well as lower your risk of depression and anxiety. There's also been a big push for yoga to help with sleepiness. And so it does help to alleviate stress, and it's really good for reducing pain. And if those are your factors that's keeping you up at night, then it's definitely beneficial. There's just not a direct connection with yoga and sleep yet. The verdict's still out on it, but definitely recommended if you're one that stresses a lot or carries your worries to bed with you, and for someone that has significant pain and you're likely to wake up from your pain. And then finally, in terms of your exercise regimen, experiment with the timing. Typically, it's encouraged to complete it during the day and avoid doing it in the evening hours. That's not really the case for everybody. I would say if you're a morning person, it's definitely recommended that you complete your exercises in the morning. And if you're an evening person, you could get away with doing an evening workout, but still much better to get that exercise and get some level of physical activity and maybe not as vigorous if your only option is to do it after dinner or before bed at some point, okay? 30 minutes of moderate exercise is really all you need. No need to really overdo it. Next slide. Diet, increased risk of cardiometabolic disease, especially for lower rates of sleep. So if you're sleeping 6 hours or less, you have a greater chance of developing some kind of metabolic disease or worsening some of your conditions that you may already have. Unfortunately, poor sleep increases our appetite and it drives poor food choices, because when you're awake in the middle of the night, or even when you're stressed, you're hardly ever craving a broccoli or kale. You're wanting the sweet and salty snacks, right? This increased food intake, poor food intake, will then also lead to reduced physical activity and can even promote insulin resistance. So you're just kind of putting yourself at risk for conditions like hypertension, diabetes, heart disease, obesity, etc. Next slide. So what you want to try to do is, again, keep consistent meal times and have substantive meals throughout the day. So many people tell me they go without breakfast. I would rather you have something, a granola bar, a glass of milk, a yogurt, something to start that metabolism and to indicate to your circadian rhythm, like, hey, it's time to get going. This is daytime now. Try to get your dinner in at least 2 hours up to 4 hours before your bedtime, and avoid going to bed on a full stomach. Again, this is that buffer period or wind down period that I'm talking about. Don't go to bed with that full stomach. And of course, avoid any caffeine, alcohol, and overly spicy, fatty, or sugary foods before bed. And so what I've included here are specific types of foods that you want to look for if you're someone that that has an early dinner and needs a snack before bedtime. Anything with tryptophan, carbs, calcium, magnesium, natural melatonin, such as pistachios, and vitamin B6 are food items that are likely to help you with sleep. But of course, you want to make sure that you're keeping other dietary regulations in mind. So if you have diabetes, again, carbs is probably not your best option. All right, and then finally, reducing stress and anxiety. All right, first, what you can do, and I apologize, this was supposed to be switched around. It must have been changed. Oh, just kidding. Okay, so what you want to do is set aside worry time, right? Schedule worry time for yourself before bed. And what that entails is essentially setting a brief time on your phone or an alarm for 20 or 30 minutes. And you sit down and you write down everything you need to get done, everything that requires your attention, things that you've been falling behind on, and put a solution next to them. When you can resolve them, how you can work through them. And if it's a significant stressor that's not likely to get resolved. So for instance, you're struggling with weight loss and you really want to lose weight, write a positive coping statement. I know I've been working hard and making dietary changes. This will happen slowly but surely, right? And so when you find yourself thinking about these same worries again, at some point and in bed, during your sleep, when you wake up in the middle of the night, you really want to focus on redirecting your mind. Don't entertain the thoughts. And so you'll say something like, I've already written that down. There's absolutely nothing I can do about it at 3 a.m. And so I will handle it in the next day when I have time. Okay. So don't necessarily engage those worried thoughts during the day. Keep it contained, keep it to a specific hour. In terms of stimulus control, again, don't take your worries to bed. Do not plan, process, or think about the next day. Keep that outside of the bed. Don't go to bed until you're sleepy. If you're struggling to fall asleep within 20 minutes or so, it's better off to stop pressuring yourself to sleep and just leaving the bed. Once you leave the bed, you're essentially releasing that pressure, and then that sleepiness will naturally come back. So go do something relaxing, something low key, and then once you feel less sleepiness, then you want to go ahead and head back to bed. And finally, relaxation. This is something you want to be practicing during the day anyways, so then it's not all compiled for you come bedtime. Try to take small breaks during the day, pace yourself through difficult tasks that you need to get through, and also make time for pleasurable activities as well. And then, of course, that's more a passive approach. And then there's active approach to relaxation, such as diaphragmatic breathing or deep breathing, progressive muscle relaxation, visualization, mindfulness, etc. There's plenty of mobile apps out there for this as well. Next. Okay. So overall, to kind of just summarize everything we've already discussed, what you want to do is try to, recognize that one bad night is exactly that, one bad night. It doesn't have to turn into multiple bad nights. Leave it alone. Leave sleep alone. Don't mess with it. Don't go to bed any earlier. Don't take any extra naps. Don't take any extra doses of medication. Sleep has a way of resolving itself. It only becomes problematic when we try to intervene with it. So rather, yes, you're having a difficult night. Yes, you slept poorly last night. No problem. Go to bed at your typical time the next night. Wake up at your typical time. Chances are you're going to feel much better after that second night. Focus on the relaxation concept. And then finally, if it's not working out for you, it's just too much anxiety, too much stress, and you don't know what to do, then you want to consider professional help. If your sleep problems are not getting better, you're relying on over-the-counter medications and taking more and more of them, and they're starting to be less effective. And then if it's causing significant impairment with your daytime function, you're just not getting through the day, you're struggling to stay awake while driving, etc., you want to start talking to someone. Next. And so the last slide that I have on here, as a clinical psychologist myself, what I focus on is cognitive behavioral therapy for insomnia, which is actually the gold standard of treatment. And it's essentially a lot of the components that I've already discussed with you, just adapted to your individual situation. This is a brief treatment, 4 to 6 sessions, and most people tend to see progress within the 3rd session. If you're not able to get in to see me or don't think you need anything quite that formal, there are a number of mobile apps that are listed down on the table there that you can also participate in. It will help you track your sleep and then learn some relaxation skills, give you some feedback on what to change about your bedtime routine, and then hopefully try to help with your sleep difficulties that way. All right, I know that was kind of fast, but that's everything. So questions?
That was fantastic. Thank you very much, Dr. Ahmed. And actually, I am going to roll right into some questions because we do have many. So I'm going to start with you, and then we'll move to Dr. Ye, because I think there's one for him in here too. But the first question that we received actually in advance was, how do I circumvent negative self-talk that disturbs the ability to sleep, such as, I'm not going to be able to get to sleep? So I know you mentioned some tips about getting up after being in bed for 20 minutes or more, but any other thoughts on circumventing negative self-talk?
With negative thoughts, you really want to focus on challenging them. What's your biggest fear? What are you worried about? What's the worst that could happen to you the next day if you go a night with poor sleep? You know, people have this dread that they're going to lose their job, they're going to go bankrupt, their marriage is going to fall apart. And that just builds the fear and makes the pressure that much more immense. And so the more that you can do to challenge those fears, to say how ridiculous, you know, recognize how ridiculous that is, that I'm going to be able to function. I've been able to do this in the past, and I will be able to get through the day just fine. If not, I'll probably sleep better the next night. Challenging them will help you overcome that pressure. And so it's a specific therapy technique as well. So if you feel like it's very significant, you want to work with a provider on it, but you can look into challenging negative thoughts online, and hopefully there should be some resources on there as well.
Thank you. So Dr. Ye, we have a couple other questions asking for recommendations. One around, what are your recommendations to have better sleep if a person has a deviated septum and snores? Any thoughts there?
So with deviated septums and snores, chances are you probably have OSA. So I would definitely recommend at least try to get a test just to see where you are at, and you know, depends on the sleep burdens and stuff like that. If you know, we can then decide on the treatment options to see if snoring is the primary problem, we might not need to go with CPAP. If you do not have a lot of events, your oxygen rate is still okay, we can have ENT specialists who also specializes in sleep, who does some surgeries like that, or even some over-the-counter things that we can recommend as well. But with deviated septums and snoring, and depends on how bad it is, it's like, you know, the chances are you might have sleep apnea, and I do recommend getting it tested.
Okay, thank you. And for Dr. Zachary, another question about recommendation. Do you have recommendations for a person waking up during the night due to perimenopause? So for menopausal symptoms, you know, is there something people can do for that, or what are your suggestions?
So the most important thing is to treat the underlying cause. So if you're having perimenopausal symptoms, you can talk to your doctor about, you know, management options. Okay, so there are certain medications that can help with that to treat that part of things. However, everyone can benefit from exercising. That does help with perimenopausal symptoms as well. So you can try to stay more active during the day, getting the regular exercises, and hopefully that will help. Of course, you know, we always, you know, if we're highly suspecting that you might have sleep apnea, then we should get you tested as well.
Thank you. And I noticed that someone had asked to see those sleep apps again. So I just went back to the slide before, so that way you could see those on the lower right-hand side for anyone who's interested. Another question we have, Dr. Ye, is marijuana a good way to relax so you can fall asleep? Or does it interfere with the natural sleep cycle?
This is a tough one. Marijuana, obviously, with now medical marijuana coming up and all that, but there's no really official stance from American Academy of Sleep Medicine in terms of, you know, marijuana is not an arsenal that I have in my sleep. Let's just put it this way. I do not encourage because it does have a lot more side effects or things that we just simply do not know enough about. And then for a fact, and keep it to yourself, I know marijuana doesn't work with me when I was in college, so I doubt that it will have much effect here and there. But some people like it or not, but from a professional standpoint, I do not recommend. And then unless you are seeking help from professional personnel who are being certified in medical marijuana and stuff like that, and I will defer to their decision. But that is not a typical thing that we recommend here with sleep medicine.
Okay, and so along those same lines, Dr. Ye, what do you think about melatonin, valerian root to help aid sleep, Tylenol PM, those types of sleep aids? Do you recommend them or no?
Right. With Tylenol PM, a lot of times I recommend my patients that if it's once in a while type of thing, and Dr. Ahmed did mention that as well, you will bring those over the counter things and then you try them and gradually you start feeling like, oh my God, I'm doubling up. And then, 25 doesn't work. I go 50, I go 2 pills, 3 pills, and then I have seen a lot. And melatonin especially, I wanted to make sure that I split this out here. I don't, if it's really for your problem going to sleep, there are 2 important things. One is dosage, the other one is timing. Melatonin is not a good hypnotic. It has a lot more circadian and clock features. It helps you to draw your body's own melatonin to start producing. Your body produces about 0.5 milligram of melatonin. So anything you get over the counter, whether it be a 3 milligram, 2.5 milligram gummy or 5 milligram, it's already a lot more times than what your body naturally produces, and which should be able to help you to go to sleep already. So the timing of melatonin is really that circadian or the clock issue. So about at least 1 to 1.5 hours before your desired bedtime, that's when you should take your melatonin if you want to take it. And then once you take it, don't worry about it. Just go to sleep when you're drowsy, okay? And no more than 5 milligram. 10 milligram melatonin does not make you go to sleep faster. And it may have more side effects that you do not want. And Tylenol PM, Advil PM, or whatever PM that they put out there, basically they just add Benadryl into whatever that's already in there. That's the main component. And it's the same thing. If you need it once in a while, fine, but if you find yourself consistently need to use that and at some point relying on it, then that will definitely be time for you to kind of seek help, especially even from the sleep specialist. Since I'm touching on this, a lot of other supplements and all that, again, they're not that well and thoroughly studied. So I really cannot recommend it or recommend against it. If it works for you and does not produce any side effects, be my guest, give it a try. Sleep is a very complex issue. It involves so many things, as you can see, just the 3 of us today, but there are so many more people from different backgrounds that are part of the sleep medicine team here in university hospitals, because it takes a village to fix someone's sleep. You spend 1/3 of your life doing this. It would take a lot of manpower and time to fix this issue. Lastly, I very much like this line. And if I tell you right now, you might be like, oh yeah, that makes sense. Sleep is almost like that 2-year-old toddler next door that you really want to be friends with, but you don't go chase them, because you chase them, they run away. You don't go chase sleep, you let sleep come to you. And a lot of times that 2-year-old, if you don't just be like, yeah, you're there, and then gradually they kind of come to you and say, hey, if you want to play with me or not. Sleep is very much like that. So don't chase sleep, let sleep come to you.
Thank you, Dr. Ye. That's very helpful.
Thank you.
Dr. Ahmed, I see you answering some questions in the chat around a very popular question, which are the blue light blocking glasses. Do they work? Do we have recommendations on brands? Do you want to speak a little bit about those blue light blocking glasses and if they work for people maybe on computers all day even for work?
Sure. So to be honest with you, I don't know enough about them. I worked mostly with light boxes and bright light therapy in that sense. I do know that they can, from personal experience, they can be helpful if you start to feel strain on your eyes, if you've been on a laptop for most of the day, as well as with migraine management. It seems to help me. There's not a specific brand that I recommend other than whatever works for you in your pocket. I would say though, work on changing the settings on your screens first. On your laptop, on your cell phone, use the blue light filter, reduce the brightness on your screen, and also take breaks away from these electronics. That's going to be a lot more effective for you. And then if all else is failing and you're looking into some light blocking glasses, then they certainly cannot harm. Give it a shot, but I don't have anything more specific than that.
Okay, Dr. Ye or Dr. Zachary, anything else to add regarding the glasses, or did that pretty much cover it from your perspective as well?
Yeah, I mean, glasses, my daughter wears them because of the virtual schools, and I even have a blue light blocking screen thing, and I don't know, but she seems to be falling asleep okay. So maybe it works, but again, the stimulation is not just about the light exposure as well. It's about the content. Just imagine, I actually run into problems with reading how many active cases, how many new cases I had right before I go to bed. And I find those things really disturbing. Sometimes I'll be like, oh my God, I'm having trouble sleeping. And then I started talking. It's like, you're a sleep doc, you're having trouble sleeping. What's wrong with you? And then I was like, oh yeah. And then I stopped doing that and problem solved. So there's a little bit more to that than just the blue light, but definitely if you find those glasses useful for your eyesight, for anything, for your anxiety level, for your, give it a try. But I don't have a recommendation for any particular brand.
Okay, thank you. Dr. Zachary, we have questions around folks needing, to take frequent bathroom trips in the middle of the night. That happens. Any tips or recommendations on what to do if that's something that is occurring for you, needing to get up to use the restroom in the middle of the night?
Right. So that could be one of the symptoms of sleep apnea. So we need to make sure that they don't have sleep apnea and treat that if that's the case. Of course, there are other issues that could be going on that are leading to bathroom trips, such as medication. A pretty popular medication is, water pills that people take at night. So these can lead to multiple trips as well. So we just need to make sure on our end, at least, that the patient does not have sleep apnea, which can lead to the patient getting up and having multiple bathroom trips. Of course, another issue for men would be prostate issues. So that also would need to be looked into. In terms of recommendations, if you're drinking a lot of water at night, try to drink your fluids earlier in the day. Try to stay away from, a few hours before going to bed. Try to stop all kinds of fluids so that you are hopefully going to the bathroom before you go to bed and not having to make as many bathroom trips. But then again, it's important that we evaluate you and make sure that nothing else is going on that is leading to the multiple trips, and trying to make sure that you're well hydrated during the day and earlier on in the day is very important as well.
Terrific, thank you. And thanks to the panelists too for answering some other questions in the chat as we continue on. Another area that someone had asked about, and this may go back to the stimulant section that you were discussing, Dr. Ahmed, that having coffee in the morning, in the afternoon, is it okay to have coffee every morning to feel like you need that to wake up? Is it okay to have it in the afternoon to avoid that nap?
Absolutely. Moderation is key here, just like with most dietary options, right? So you want to try to limit your coffee to no more than 2 cups a day, so about 8 to 16 ounces, and keep it earlier in the day. So anything before 12 o'clock, you're relatively safe from having it impact your nighttime sleep.
Okay, and then for someone that does feel like they're having, thoughts in the evening, they try to exercise, they eat healthy, but their mind just is not turning off. You mentioned something about the worrying journal. But when do you say okay, I can't, when do you know it's time, I guess, to reach out to a specialist? Can you remind us again about maybe when to seek help?
When it comes to anxiety or ruminating thoughts, really there's no bad time to reach out. You can do it as preventative care. You can also do it in response to a significant stressor that you might be going through at that time. There's always self-help guidelines for anxiety management, ruminating thoughts, or worry thoughts. Or you can also meet with a counselor, therapist, or a psychologist. I would recommend, as long as it's taking away from you and you feel like it's significantly impacting your sleep or other factors of your life, then I think it's worthwhile trying to talk to someone about it.
Okay, thank you. Oh, this is a good question from somebody, and I've heard about this I know we're at time, but I'd like to ask this one if you're okay. The use of audio to help sleep, like sound blocking, ambient sounds, music, waterfalls. Any thoughts on whether that helps or hurts maybe the depth or the wellness of sleep that you get?
I The verdict is out. I let my patients decide. It really depends. So like for someone with like tinnitus who essentially need white noise or a fan running in the background, that helps reduce that. Sometimes people need some kind of background noise because they feel more comfortable so they don't have to hear the outside noises if it's a single woman, for instance, living in a home by herself. I leave it up to you. My only suggestion is to not have something that is disruptive, that either stops with commercials or is a changing station, like different radio stations where some songs might be louder and some songs might be, calm and peaceful, anything that might be disturbing to your sleep. So if it's something that's repetitive and just playing on a loop and more calming, then I think that would be perfectly fine. You also don't want to be waking up in the middle of the night to change the setting or skip a song because you don't like it. So find something on a feedback, on a loop that you can listen to and tone out, but it's not something that's needed. But if you benefit from it, it doesn't have to be problematic.
Okay, thanks. And thank you all again for your time today and for our speakers for sharing the information and answering the great questions that were posed. At this time, I just want to give a couple reminders to those in attendance. We will email a link to view this recording as soon as it's posted on our website. So that might take a few days, but as soon as it's posted as a registrant of today, you will get that link to view the recording. And if you are interested in scheduling an appointment with any of the specialists that spoke today or our other sleep specialists near you, please call 216-294-3943, and we'd be happy to schedule something for you. And that concludes today's webinar. Thanks for joining us. Have a great afternoon.